This video provides an overview of the Kentucky Health Information Exchange's quick entry for negative COVID-19 test results functionality in the ePartnerViewer. In this video, I will demonstrate how to complete negative COVID-19 lab data entries in the ePartnerViewer. Quick entry for negative COVID-19 test results is best utilized when you are entering negative COVID-19 lab results. This is because it allows you to enter up to 10 different patients with negative test results at the same time. Please note, directions on how to create ordering provider and ordering facility details and how to complete positive COVID-19 lab data entries are included in the Direct Lab Entry User Guide and the Direct Lab Entry and Ordering Details training video. Prior to entering lab results, you are required to enter information regarding your ordering provider and ordering facility on the Manage User Preferences screen. By entering the ordering provider and ordering facility details in your user preferences, you will be able to quickly select an ordering provider or facility from drop-down options instead of manually entering the ordering information with each individual lab data entry. Please note that all examples in this video are simulated with mock data and no protected health information or PHI is present. To start a quick entry for negative COVID-19 test results, log in to the ePartnerViewer and click the Lab Data Entry tab in the blue navigation bar at the top of the screen. Select Quick Entry for negative COVID-19 test results from the drop-down menu. Quick entry for negative COVID-19 test results is a 4-step process where you must enter observation results, provider details, and patient information. Prior to submitting the lab results, you must review the accuracy of the information you've entered on the lab data review screen. The final step is submitting the negative COVID-19 test results. On the observation screen, select the performing facility name from the drop-down. This will be the name of the organization that resulted the lab for which you are entering results. This is usually the name of the organization that you are associated with. As mentioned, you are required to enter the ordering provider and ordering facility details on the Manage User Preferences screens before you actually enter the lab results. This allows you to quickly select an ordering provider or ordering facility from the drop-down options. Select at least one of the options available in the ordering section. As appropriate, select the name of either the ordering facility or the ordering provider from the corresponding drop-downs. If you select an ordering provider from the drop-down, the ordering provider NPI will automatically populate in the field. Select the appropriate specimen type from the drop-down. Please note, if you administered the BinaxNOW COVID-19 test, please select anterior nair swab as the specimen type. Next, enter the specimen collection date. Now select the appropriate test type. To view a categorized list of test types and test names to assist with the selection, click the Select Test Type hyperlink, and then follow the steps listed in the Test Type subsection of the Direct Lab Data Entry User Guide. Based on the selected test type, the test name dropdown will only display test name options that correspond with the selected test type. When applicable, select the appropriate test name from the dropdown. Next, select the appropriate test result from the dropdown. Enter the observation result date. Please note, the specimen collection date cannot occur after the observation result date. The specimen collection date must occur on the same date or any date before the observation result date. If you enter a specimen collection date that occurs after the observation result date, then both fields will be marked as invalid. If you click Next, the observation screen is grayed out. To proceed, you must enter a valid specimen collection date that occurs on or before the observation result date. Once complete, click Next to proceed to the Patient Information screen. On the Patient Information screen, enter the filler order number or lab accession number. The filler order number or lab accession number is typically utilized by laboratories. This generally refers to the number assigned to a lab sample when it is checked in. If your organization does not log the receipt of specimens, you should create a system to uniquely track the specimen when you check it in. Enter the patient's medical record number. A medical record number, or MRN, is an organization-specific, unique identification number assigned to a patient by a healthcare organization. If your organization does not use an MRN, you must create a way to uniquely identify your patient so that the patient is registered in the KHIE system. Enter the patient's first name. If known, enter the patient's middle initial. Then enter the patient's last name. Enter the patient's date of birth. Please note, if a patient's age is either under a year old or more than 100 years old, a notification pop-up will display to confirm the correct birth year has been selected. Now select the patient's sex from the drop-down. And finally, enter the street address, city, state, zip code, and county for the patient's home address. However, in cases of congregate care, enter the address of the nursing home, group home, or similar congregate care facility. Hover over the help icon to assist with entering the correct address information for the patient tested. Please note, when entering the test results of facility employees, please enter the home address, not the work address. You have the option to enter negative lab results for different patients who had the same test type. This means you can easily enter up to 10 different patients with negative lab results. To add another patient, click Add Patient at the bottom. Enter the filler order number or lab accession number. Now enter the patient's MRN or medical record number. Enter the patient's first name and last name. If known, enter the patient's middle initial. Enter the patient's date of birth. Then select the patient's sex. Then enter the patient's street address, city, state, zip code, and county. If you need to delete a patient, click the trash bin icon at the top left. Click the minus icon or click any of the numbered patients or patient information hyperlinks to hide the details for that patient. To display hidden patients, click the plus icon. Once complete, click Next to proceed to the Lab Data Review screen. The Lab Data Review screen displays a summary of the information you've entered. You should review this screen to verify the accuracy of the information prior to submitting the lab results. Review the Observation section. Then review the Patient Information section. Please note, if multiple patients have been added, the Lab Data Review screen will display all patients in numbered order. If changes are required, click the corresponding hyperlink to navigate to the appropriate screen or section to edit the information. For example, you may click the Observation section header hyperlink to navigate to the observation page. If multiple patients are entered, you may click the appropriate patient name hyperlink to navigate directly to that specific patient. For this example, click the Patient Name To hyperlink to navigate directly to the Patient To section. Once the appropriate edits are completed, click Next until you navigate back to the Lab Data Review screen. After verifying the information is accurate and/or the appropriate changes have been made, click Submit to submit the negative lab entries. All data submissions are final. Select Cancel to continue reviewing, or click Submit to finalize the negative lab entries. Click OK when the lab data entry has been submitted successfully. Please note, once a lab data entry has been submitted, it is final. Should you later discover that you have entered inaccurate information, please reach out to the Kentucky Department for Public Health at covid19dr@ky.gov to determine options for correcting the entry. Congratulations! You have submitted the quick entry for negative COVID-19 test results using KHIE's Direct Lab Data Entry functionality. For additional training resources, such as the Direct Lab Entry User Guide and the Direct Lab Entry and Ordering Details training video, please visit the KHIE website at khie.ky.gov. Thank you for watching this demonstration.